So dental implants have a lot of place in the dental office, and especially in my office at West County Dental. There's anywhere from one missing tooth to multiple missing teeth, or maybe somebody who already has their teeth out and has a denture that's not fitting well, and they want to have it fit better, or partial, or something of those sorts. The best thing I can do is say, call our office, come in for a consult, and let me kind of talk to you about how we can help you out. A dental implant is basically a simple replacement of a missing tooth or multiple teeth. It's a surgical grade titanium that is placed in the jaw gently. A dental implant is the closest replacement to a missing tooth for many reasons, but simply is that I don't have to touch the teeth on either side of it. It can handle the stresses of eating. It's lifelike once we place a crown or a denture on top of them. That's as simple as that. People always ask, how am I a candidate for an implant? And what I throw back at them is, well, do you have a tooth that needs to come out? Do you have a missing tooth? Or do you have some teeth that need to come out? The best option a lot of times is a dental implant or multiple dental implants. Call us at West County Dental. We'll get you in and check and see if you're a candidate. People ask, when they're a candidate for an implant, does it make sense doing an implant, a bridge, or a partial, or a denture? Those are all different ways of replacing missing teeth. The beautiful thing about an implant is that you're just replacing what's missing. And that's why those have a really great place in my office. The benefits of an implant over a bridge or a partial or a denture is that we're really just kind of replacing what's missing and restoring you back to normal function that way. People always ask about a dental implant and its longevity, and I always tell people that don't just think it'll last you the rest of your life. We want it to, we hope that it does, but it does still take maintenance around it just like a normal tooth does. It also means coming to the dentist on a regular visits for cleanings, and so that we recommend a night guard for somebody if they clench a lot, because why did you lose the tooth to begin with? So it's not just a matter of place and forget. There is a follow-up just like with your normal teeth. People ask, I want a dental implant. What's the process from start to finish? First is you come in for a diagnosis, and we talk about, yes, you need an implant. If a tooth needs to come out, we take a tooth out, we bone graft the area. That period takes sometimes a couple months for it to heal. Then an implant is placed. That implant needs to heal for a few months also. And then at that point, we use a laser to uncover the top part of the implant, and then we're able to make a same-day crown and abutment on there. One thing I love about dental implants is they do stop the resorption of bone. Resorption means the melting away of bone. Once a tooth is lost, the bone does want to kind of melt away, and an implant, just like planting a tree on the hillside keeps erosion from happening, is the same analogy in the mouth is that an implant keeps the bone from eroding. People always ask at West County Dental, is it a good investment in implants for good oral health? And I always say missing teeth is not a good investment. Replacement is a better option, because longevity, function, quality of life can be given back to you by having dental implants. I also get asked quite a bit about discomfort with dental implants. Placing them themselves, it's a light numbing typically for a dental implant. And what people find is that the discomfort they have after removing a tooth is a lot less even with placing a dental implant. People ask a lot about the cost of a dental implant, and it varies from case to case, and so it's hard to always come up with a number. What I can say is that the cost of a dental implant is gone over at the office when you come in for a treatment plan, and then any other side factors that occur, whether it's if you need a bone graft or if you need any additional reinforcement for an implant. But all of those factors come into mind, and we have treatment plans. And so the treatment plans and the third-party financing that we do have at the office is something I ask you come in and talk to my office about, because Debbie and Tanya at the front are very good at going through your options to help you make it affordable for you.